Good day, guys. Today we look at pediatric examination review questions. Okay, kindly sit down and pay attention. So let's go. Number one.
Number 1A. List any 5 respiratory infectious diseases of public health importance.
All right.
5 marks.
5 marks. List. Please don't explain. You have to what to list. So as you can see on the board here, we have some of the respiratory infectious diseases that we have in children: diphtheria, tuberculosis, respiratory syncytial virus infection. Please, in the exam, write it in what? In full. Respiratory syncytial virus infection. Asthma, pneumonia, pertussis. Pertussis is also called what? Whooping cough. Whooping cough. Then we have pharyngeal tonsillitis. So any 5 that you can remember, please just list and you have your full 5 marks. The next question, please.
1B. Write extensively on any of the 2 mentioned above.
Correct.
10 marks.
10 marks. For example, if I'm to talk about tuberculosis and what? And pneumonia. Those are the 2 that I've chosen to talk about. What you just need to do is to follow these subtopics. For example, look at tuberculosis now. I'm going to talk about definition, transmission, symptoms, treatment, and prevention. Each of them carries 1 mark. So in the exam, you must write, even if it's just a line or 2 lines that you can write on, please, you must touch each subtopic. Tuberculosis, definition of tuberculosis. Tuberculosis is a chronic infectious bacterial disease of the lungs caused by what? Mycobacterium tuberculosis. Once you write that, it's okay. Transmission, that's the next subtopic. Transmission. How is tuberculosis being transmitted? It is transmitted by what? By air droplets from cough or sneezing of an infected person. Full stop. You also have your 1 mark. The next one, symptoms of tuberculosis. You have, if you remember, we talked about that in class, cough, persistent cough, persistent productive cough. Remember that fever, because the condition is caused by what? A bacterial infection. So there will be fever in tuberculosis. Then you can also talk about other things, like you can mention weight loss. Okay, you can mention lethargy or weakness, general body weakness. Okay, then you can mention other ones like loss of appetite, drenching night sweat. Full stop is okay. Treatment. How do you treat tuberculosis? Just write number 1, anti-tubercular drugs. Anti-tubercular what? Drugs. If you remember your RIPES, RIPES, just say anti-tubercular drugs such as rifampicin, isoniazid, pyrazinamide, ethambutol, and what? Streptomycin. You are good to go. Then apart from that, you also what? Hydration. Hydration. You can also give them nutritional support. And because of the fever, we can also give them some antibiotics. Antibiotics. That's okay. Prevention. How do you prevent tuberculosis? By what? By reducing crowd. Overcrowding is one of the risk factors. Overcrowding, okay? So by reducing crowd, okay? Number 2, by giving them what? Vaccination. You talk about vaccination. You remember your BCG vaccine that you give at birth. So then other ones include public health measures. You tell people, the community, about how to prevent transmission of tuberculosis. That's all. I know you have full 5 marks. Number 2 you have on the board is what? Pneumonia. Definition of pneumonia. Pneumonia is an acute infection of the lung parenchyma. Acute infection of the what? Lung parenchyma. Characterized by what? Cough, fever, and difficulty in breathing. Okay? That's all. What are the causes of pneumonia? It can be due to either infectious causes or non-infectious causes. When we talk about infectious causes, remember in class we talked about what? Bacterial, viral, fungal. Okay, those are the infectious causes. And under bacteria, just mention one organism. You are good to go. Under viral, mention one organism. Under fungal, just mention one organism. If you remember, we talked about PJ, Pneumocystis jirovecii. And it's common in what? Immunocompromised patients. You are good to go. For the non-infectious causes, remember we talked about what? Aspiration pneumonia. Full stop. Risk factors of pneumonia. The risk factors, okay, remember the code, right? Lack of what? Lack of nutrition. Lack of nutrition. Age. Children less than 5 years are usually what? Exposed or more prone to coming down with what? Pneumonia. And other ones, environmental factors and the like. For the symptoms, cough, fever, difficulty in breathing, chest pain. Full stop, just list. Then for the treatment, how do you treat pneumonia? Most of the time, it is usually not so severe, so you might not need to admit. But in cases of when they come with severity, such as if the SpO2, if you remember in class, once the SpO2 is less than 92%, you have to admit this patient. If the fever is so high, you have to admit this patient. So it depends on the presentation. That will guide you to how you're going to treat that patient. Then the antibiotics we usually use is what? Amoxicillin or macrolides, such as erythromycin. For the prevention of pneumonia, almost the same thing with tuberculosis too. Avoid overcrowding, avoid exposure to dust, to smoke, and all that. Then you also give vaccination. Always remember that. We're talking about children. Always remember your what? You advise them to go for their vaccination. For example, HIV, Haemophilus influenza type B vaccine that we give at what? Also at birth too. So that is that. So in this class, I've talked about what? Tuberculosis and pneumonia. So in the exam, you can decide to talk about diphtheria and pertussis, or you can decide to talk about asthma and tuberculosis, as the case may be. But please make sure you follow these subtopics. Thank you. So I'll see you in the next video.